Welcome back to our special here on the First TV about Make America Healthy Again. I want to go to Dr. Aaron Kheriaty, author of The New Abnormal, The Rise of the Biomedical Security State. He's also a scholar at the Ethics and Public Policy Center. Dr. Kheriaty, thanks for being here, sir. I want to talk to you because we've talked about diet and food earlier, but there's a lot of aspects of health. We spent the first monologue of the show talking about the ancient idea of health, going back to the ancient Greece about mind, body, soul, sound mind, sound body, and how we've sort of lost that recently. So I just want to ask you about our state, our mental health state in America, and also our soul health in America. How would you assess those two things?
So unfortunately, we're not doing very well in that regard. And one marker of this is the rise over the last 25 years, since 1999, of what scholars call deaths of despair. That's deaths by suicide, alcohol-related illnesses, and drug overdoses. Those have been on the rise for 25 years. That was grossly exacerbated and exaggerated by the lockdowns and the school closures and the other misguided policies during COVID, which made that crisis much, much worse. And we were very, very focused on one virus, one illness at that time, forgetting the downstream negative mental health effects of many of these policies, like prolonged school closures and lockdowns. And as a consequence of that, we have suicide rates that are higher than they've ever been before, including among young people, among both men and women. And we have an epidemic of drug overdose. Another thing that is contributing to this, which again was exacerbated during COVID, is the epidemic of loneliness. And loneliness may not sound like a medical issue or even necessarily like a mental health issue. Maybe it's sort of like a problem of everyday living. But it turns out that loneliness worsens health outcomes, not just mental health outcomes like depression or anxiety, but it worsens general health outcomes like heart attacks and strokes and cancer in the same way that smoking 2 packs of cigarettes per day does. So as human beings, we're built to be in connection and in relationship with other people. And again, over the last couple of decades, and there's been many in my field and many social scientists that have written about this. If you ask people back in the 1980s, for example, do you have someone important in your life with whom, someone close to you with whom you can discuss important matters, which is a pretty good proxy for loneliness? Only 20% of people said, no, I don't have anyone, a family member, a friend, a colleague at work with whom I can discuss important personal matters. And, 1 in 5 people not having that is a bad thing. Well, that number is now doubled. It's now 40% and rising. So 4 in 10 Americans have no one in their life with whom they can connect and discuss important matters. That has very profound effects on our health. So, in addition to all that, there are also political implications for this crisis of loneliness. Hannah Arendt, who studied the 20th century totalitarian systems, noticed that totalitarian leaders are able to control a population when that population is lonely and isolated. She described what she called organized loneliness, which was a deliberate political program of separating people, of dividing families, of isolating individuals. And it's been long known that in order to control a population, you have to basically get people to feel like they're not connected with others in society. And then it's easier to manipulate them, which again, I think we've seen signs over the last several years that a kind of organized loneliness exacerbated by the pandemic put people in a state in which they could be more easily manipulated politically. I think we're starting to see some pushback on that. We're starting to see a societal reaction against that with the Make America Healthy Again movement, with the recent election. So I'm hoping that we can finally start addressing this crisis of deaths of despair, crisis of loneliness, because it's a very serious problem, at the psychological level, at the general physical health level, but also it's a problem at the social and even at the political level.
Yes. Trying to think of the root as you're chatting. I'm thinking of what led us to this loneliness epidemic point. So I think some of the easy ones that just pop into my head is probably decrease of church attendance, right? That was
Yes.
Sort of a built-in community you had. More
That's right.
transient, a lot of moving, right? Like my parents grew up in the same block and lived there forever, but now we
Yep.
move all the time, so it's hard to make community there. Maybe just the way we design our cities and towns at all, like suburbia, like bigger backyards, no front yards, things like that. Social media, we were promised more connection. Of course, that was a lie. We got less.
Right. Right.
What else? Anything else I'm missing? And I ask these because hopefully we can turn the clock back. Or what can we do to maybe fix some of the big ones?
Yeah, absolutely. I agree with all of those. In fact, there's robust research literature to support all of those. My colleague Claire Morell at the Ethics and Public Policy Center has done a lot of work. Jonathan Haidt and others have done a lot of work on the effects of technology and social media, which again, as you mentioned, was supposed to connect us, but ends up leaving us more lonely and isolated in many cases. I think especially for adolescents who don't necessarily know how to navigate that world very well, but also for adults who get sucked into misusing technology. I mean, technology is a great thing, but it's a two-edged sword. You mentioned church attendance. That's another really important one. So the decline of religious participation is another thing that actually has been very well studied, even in my secular field of psychiatry. I have a colleague at the School of Public Health at Harvard, Tyler Vanderweel. His Human Flourishing program has done a lot of work on this. He published something in the Journal of the American Medical Association a few years ago showing that church attendance reduces suicide risk. This was a massive population-based study of nurses in the United States. And that replicated findings that we've seen really for the last 100 years on suicide. We know that religious participation reduces the risk of suicide, which is obviously the worst mental health outcome, the most tragic mental health outcome, a downstream consequence of addictions and depression and bipolar disorder, other serious mental illnesses. And it's not to say that religious participation or religious faith automatically inoculates you against suicide, right? There's many other factors that can contribute to someone ending their own life tragically, but religion and religious participation has been shown to be one of the most protective factors. Part of that is probably the moral teachings against suicide among all of the major world religions, particularly Christianity. Another aspect of that is the hope or the meaning or the purpose that people can find in religion, which gives them something to stand on, gives them strength when they're going through difficulties. But a third factor is simply being with other people, right? Which you can find in places other than churches, but for many, many people, Sunday participation in a worship service or a weekly Bible study or a small group that they participate in, that's a source of very profound support. And when you share something as deep and important as religious faith with a group of other people, that can profoundly reduce the possibility that someone feels lonely and isolated and feels like they have nowhere to turn if they are in crisis. So the secularization that we're seeing in Western societies, I think, is another major component. You mentioned the design of cities. You mentioned, the way, I could add to that, the way in which our professional life is very often organized. That's, a few generations ago, a kind of rootedness and loyalty to a particular company that I might work at for my entire career gave people a sense of stability and purpose and a professional identity that today is very unstable in an economy in which people are routinely changing jobs. And, there's pros and cons to both models, obviously. But I think we've, as a society, moved so far in the direction of rootlessness and instability in those traditional places where people found a sense of purpose and meaning and identity are, were solid 50 years ago and are much more liquid, much more fluid today. And I think all of those factors are a part of what we're seeing here at work.
Very well said. We've got about 2 minutes. I don't know if we have enough time to talk about the effects that Obamacare created on where we are right now, but, and this, my instinct is not to look for political solutions to these things, but that's kind of like the nature of this show and this network. So we're excited about RFK Jr., et cetera, and the people, the personnel that are now in DC, and we can maybe get rid of some of the bad things that we've done at least. What's a political answer that you think would be wise moving forward?
Yeah, so Obamacare, we could spend hours talking about it, but just in a nutshell, in 30 seconds, it created a kind of centralization and moved us further in the direction that we were already going of increased centralized top-down managerial control of medicine. I think medicine needs to move in the opposite direction toward decentralized, sort of grassroots, sort of, homeschooling movement for medicine models of providing care to patients. People do not like our current medical system. They do not like the way that the state in which they find themselves when they go to the clinic or they go to the hospital, and the physician is staring at a computer screen rather than talking face to face with them and examining them. And so we've moved so far in the direction of top-down bureaucratic centralized control in medicine, Obamacare being one piece of moving us in that direction. And I think we need medical freedom. We need decentralized control. We need to allow models of direct primary care and other things, cooperative models for health insurance that are growing up on the grassroots. We need to let those models flourish and see which ones of those models are economically feasible and deliver good care for a good cost. And so I'm hoping the new administration will kind of cut down on the centralized bureaucratic control that we see in our public health agencies and allow many different medical models to flourish so that doctors and patients can find ways of providing good care at an affordable cost in a way that people don't hate, right? They're not so disinclined to want to go see their doctor and being put through this bureaucratic machinery that feels totally depersonalized and not really attentive to their needs.
Yes, we'll let DC do that, get out of the way, and we can take care of the rest of these things in our culture at large. Dr. Aaron Kheriaty, go buy the book, The New Abnormal, Rise of the Biomedical Security State, and grateful for all your work at the Ethics and Public Policy Center. Dr. Kheriaty, good to talk to you, sir. Thank you.
Likewise. Thanks, Mike.